If you have rheumatoid arthritis, you're probably familiar with the pain, swelling, and stiffness it can cause. You might be wondering what causes these symptoms, how to treat them, and if alternative therapies can help. Dr. Stanley B. Cohen, a clinical professor at the University of Texas Southwestern Medical School, has broken down all things RA in a WebMD webinar. He explains who is most often affected by RA, risk factors for additional health issues, and lifestyle habits that can help. Dr. Cohen emphasizes the importance of managing inflammation, hypertension, and elevated cholesterol in people with untreated rheumatoid arthritis. He also shares that successful therapies have reduced the risk of premature death, bringing mortality rates more in line with the normal population. Many people find that making lifestyle changes can help ease their symptoms of rheumatoid arthritis. In a recent webinar poll, 31% of viewers said they used low-intensity exercises to reduce their RA symptoms. Eating healthy foods and staying informed about RA were also common responses, with 28% and 26% of viewers choosing these options, respectively. Other habits that can ease RA symptoms include not smoking and having support from family and friends. The COVID vaccine is generally not linked to rheumatoid arthritis, RA, and does not cause it, although there have been rare cases of new RA and other forms of inflammatory arthritis reported after vaccination. Hydroxychloroquine works by trying to turn off the overactive immune system in RA, and while it can be effective, medications can sometimes stop working after long-term use. RA can also lead to mental health issues, and other health conditions like psoriatic arthritis, lupus, fibromyalgia, and axial spondyloarthritis can mimic RA. During an RA flare, rest is important and it's best to avoid strenuous exercise. Moderate alcohol consumption is generally fine for people with RA, and intermittent fasting may be helpful for weight reduction in obese patients. While there is no data suggesting medical marijuana can help with inflammation in RA, it may have benefits for pain, stress, and anxiety. There are a few factors that can increase your risk of developing rheumatoid arthritis. Genetics: certain genes involved in the immune system can put you at a higher risk for RA. Environment: things in your environment, such as infections, smoking, or exposure to silica, can also trigger RA. Smoking, in particular, can increase your risk of developing RA if you have the genetic makeup for it. Rheumatoid arthritis, also known as RA, cannot be cured, but there are effective treatments available. The main goals of treatment are to prevent joint damage, reduce inflammation, alleviate symptoms, and achieve remission. There are several types of medications that can help provide relief, including nonsteroidal anti-inflammatory drugs, NSAIDs, steroids, disease-modifying antirheumatic drugs, DMARDs, and biologics. In addition to medication, making lifestyle changes can also be beneficial. This includes participating in physical therapy and occupational therapy, quitting smoking, losing weight if needed, eating a balanced diet, seeking social support, staying informed, managing stress, and engaging in low-impact exercises. In some cases, surgery may be necessary, but the ultimate goal of treatment is to avoid this.